Well, a recent report from the CDC shows the rates of anxiety and depression among adolescents has tripled since the pandemic began.
That is alarming, but there are ways we can help our children and each other as we enter the colder months. Earlier today, we talked with the medical director of Unity Point Health Meritor's Child and Adolescent Psychiatry Hospital, Dr. Katie Schmitt.
So what trends are we seeing in kids struggling right now?
In the hospital, we're seeing a definite trend involving social isolation. You know, these kids now for months have been unable to participate in pro-social activities. They're not going to school with their friends. They're not doing the things they enjoy, like sports or music or engaging in things that bring them self-esteem. So I would say isolation is just wearing down so many kids. And I think the other thing is that we don't know when it's going to end. So it's not like the kids can mentally set an end date and say, okay, I got to go till, January or February. It's this uncertainty. And I think that breeds a lot of hopelessness and anxiety and just uncertainty about, when things are going to go back to normal for them.
Kids are struggling and parents are struggling. What are some of the things that parents should be paying attention to and watching for at home with their kids that could be signs of trouble?
That's a great question. And I think there are a lot of different things that parents should be on the lookout for. Some of them involve like symptoms. So maybe noticing that their kids are experiencing lower energy. They're just not wanting to engage in some of the things that they used to find really pleasurable or enjoyable, but also function. So a lot of kids they're just not logging into school. They feel overwhelmed, so they're just closing their laptop, right? They're disconnecting. So I would say more of like an impairment in keeping up with schoolwork, keeping up with just sleep. Sleep structure has been impacted so severely because there's just not that structure and routine. So kids are going to bed much later. They're waking up later. So everything's just being shifted. So I would look for some of those symptoms, but also some of their kids' ability to function.
What can parents do to help in that area?
I think trying to provide some of that. So I really encourage families, put a structure in place. A lot of parents aren't at home anymore. They're going to work, so the kids are at home alone when they're doing their education. So try to put a structure in place. This is when you're going to do school, take a break for movement, take a break for lunch. And I think helping kids then stick to a sleep schedule, take care of their bodies, whether that's eating healthy, being active, just that structure and routine and spending time together. I think that's really important moving forward, especially in the winter months.
We're very lucky to have the Child and Adolescent Psychiatry Hospital in our community. It's a resource there when families need help. What other resources are available for people who really need some support right now?
Yeah, and that's also such a great thing to bring up, Susan, because a lot of the resources in the community are overwhelmed. A lot of the kids trying to establish care now are doing it virtually, and it's hard to connect to people that way. Also, a lot of those in-home family services, they're on pause or they're trying to do it virtually, which is also a challenge, but still so important to reach out. I would definitely start with your primary care provider if parents are concerned about their kids, reaching out to them for therapy referrals or just checking in with the kids to make sure they're doing okay. You can also access your insurance company to see which therapist they may recommend. Also reaching out to schools. So they still have support staff, guidance counselors. So reaching out to them not only for the social support and emotional support, but for academic support as well.
And we don't know what the long-range effect of all this is going to be down the road.
Mm-hmm. We don't. And right, it's the crisis within the crisis. We're hearing so many of those things where COVID is causing these changes, but there's so many downstream effects that we're going to be supporting our kids and adults through for a long time.
Help is out there, and
that's good to know.
And seek it.
Yeah.
Katie, thanks for being with us today.
Keep up the great work, Katie. Thanks so much for your time.
Stay well.
Take care, you guys.
Help is on the way.
Yeah, it's a remarkable, remarkable service that we have. We're lucky to have it here in Madison.